doctors. You can now create your electronic medical record and do medical research. You just log into the website after registration and validation of your ID as a doctor. You will have this link in health as an EMR, which is available only to a doctor, which is validated for this website. As you click this electronic medical record, you will come across this page first, where you can see your old record, which that patient is discharged already, either in OPD or IPD. Once the record is closed, it will come here. And just write the phone number. You can select your patient from your phone number, and you can see his previous medical history by this. And this is automatically generated, as I'll tell you how this can be generated. Now, as you can see the list of your OPD patients if you have registered, and those patients who are still active, you can see OPD and IPD both. First, you can see various links: health evaluation, symptoms, signs, diagnosis, everything. First is health evaluation. On clicking this, you can see the previous health evaluation record, and all basic medical history is taken: dietary history, alcoholic and hygienic, everything. All this previous history can be quickly taken from every patient, and record is generated and it is saved here. And then you can click on the symptoms, and you can add more symptoms, or can edit the previous symptoms. And as you add new symptom, you can select from the symptom list, which is available symptom. As you start writing, and the symptom will be listed, and just click it. And this onset, duration, progression, all this you have to just click in, and the history will be written in text for you. So the values are stored in a database format for future research. The severity of the pain, the location, if it is vomiting, there is no location, just can leave it alone. And you can write all this aggravating factor, relieving factor. Just click on that, and it will be selected. You can write in the comment whatever you want to, which is not given in the above details. So all this history of a patient's symptoms can be generated by our junior doctors or even nursing staff. So once you generated the history, you can see the various symptoms and details in a very view format. You can quickly go through the symptoms of these patients. Then as you click on the sign, you can select from the available sign which is already there, or you can write new signs, and that will be stored in the history, which will come later on also if you start typing. And just click on this symptom severity, and you can store the symptoms as much as you can. So the symptom and signs are stored. Now the diagnosis of this patient, you can edit the diagnosis, you can add new diagnosis. Suppose the diagnosis is, in this case, suppose acute appendicitis. Just click on that, and as you click on this diagnosis, you have to fill all in the parameters of diagnosis, acuteness, the site involved, secondary diagnosis, and there are many other diagnostic features which is there in this. So diagnosis has to be stored, and then depending on the diagnosis, the advice is automatically generated. I'll show you later on. If you are giving some advice, that advice is automatic. Now the investigation can be stored. You can write the hemoglobin and all the essential investigation that we do for the patients. Usually you can add that, and after adding the investigation, the beautiful feature is that you can track the investigation report from the admission. You can see the hemoglobin, what was the date, and similarly, if the patient is admitted for 1 month, you can see the date-wise hemoglobin and all other parameters which is there. You can track the value of those things. For a radiologist, one can upload the radiological images. As you select the radiological investigations, the report will be automatically written from the previous report, so you don't have to type much. You can change here if you want, and you can upload any images. Support, for example, this is one image which is uploaded. You can see the images uploaded and the report which is here. And once you click the image, you can see the detail and enlarged image also. So all the radiological investigations can be uploaded and can be seen and reviewed, and the report is stored. Now one can go for the treatment here. Now in treatment, add treatment, which is most important feature is, as you select the generic medicine, you can list out all the brand name, and you can click and you can see that, and the dose and every frequency, everything is written, because once you have written that thing particularly, it will be remembered for that generic name, and you don't have to write much. So this is one feature which is very beautiful and which is very helpful for the doctor: the brand name and the generic name and the dose, everything. Now you can see all the details, and now comes the procedure, the operation notes or anything operation detail that you can add in this EMR. So as you enter the procedure, And if the surgeon selects the particular operation, all the operation notes is automatically written from the previous operation notes, and you can copy it here, and you can change anything if you want, and thus you don't have to write operation notes again and again if you have done similar cases everywhere. So writing much is causes very much. Now that comes to course. So you can enter the course of the patient, what was the daily status, and at the time will be recorded what is the daily status, what is the feeding status, what is the temperature, pulse, stool, and all these things once entered can be stored in the database and it can be followed in timeline. So one can track the course of all these patients, what is the ambulation, what is the breathing status of the patient. So any doctor or any nursing staff can enter the course from anywhere, and ultimately what is the patient overall satisfied or not. So once you add the course, it is stored in the timeline, and you can review the course again and again just by clicking here. As you click on the track symptom, you can see the symptom moderate improvement. So date-wise track of symptoms and everything can be stored and can be tracked. Now comes to the outcome. What is the overall outcome? Not only the pathological outcome, the radiological outcome, the limb outcome, the life outcome, everything has to be entered so that we can do research on the particular case, that after doing certain treatment, what is the outcome of a patient? What is the hematological outcome? What is the radiological outcome? What is the limb outcome? And once you close the case, you cannot review the course again, you cannot edit the course again, and that will go to the previous record. So it is IPD or OPD, and you can store the case in IPD or OPD, and you can review the case later on also. So now that case is closed. You can see the list name is removed from the list, and that is come here. Once you click this, and you can view the summary of the course and summary of the patient, and you can see all the records of this patient which is stored here. So similarly, you can create this medical record and discharge summary at just click of a button. You don't have to write discharge summary and case summary again and again. And this is all the features is stored. Now you can add the patient if you want. Add many as by clicking this add patient. You can register your new patients, and patient safety is very important. You can change the name, you can change the mobile number, whatever you want. You can restore the privacy of any patient, and that is not a problem here. You cannot store the problem. You can change the name whatever you like. If the patient is agreeing, you can continue with the name. Now you can see all this patient's record, and then it comes the multimedia feature. As a doctor, you can upload your voice and upload the multimedia. The video also can send to the patient, and patient can also send their multimedia, the voice and images also, and doctor can see the patient's images, voices, and video. So there is a two-way communication between the doctor and the patient. So if you want to participate in this trial of this EMR program and upload your patient's data, you can register into our website healthyhappylife.org, and once your name is there, I'll go through your record and approve you as a doctor. Then you can start creating the medical record and do it for your patients too. And I require your feedback, and after getting the feedback, we can finalize this software and use it for the common purpose. And this will be a great help not only for medical education and research, but keeping the electronic medical record. There is a lack of doctors in the hospital who can write the case summary or create a discharge summary, and this software will be very handy in that cases too.